Then we move into the agricultural revolution when people are starting to grow their own crops. And the great thing about growing your own crops is, okay, you actually have a sustainable food source, but they also saw some limitation in the variety in their diet that the hunter-gatherers had, right? So you had different nutritional concerns during this time and threats to life. And of course, we know there are threats to the reliability of crops depending on the environment and weather that lead to nutritional concerns. And then we get into the Industrial Revolution, and that's where the fun really begins that we're going to talk about today. Who knows what was happening in the Industrial Revolution? Really, I'm thinking London, 1700s, 1800s. What was going on? Yes?
Lindsey, it was the start of urban living where both mass populations of people and livestock were living in a very small and densely packed area.
Absolutely. So jobs boomed, manufacturing boomed, and all of a sudden you see this mass migration into cities, and cities become densely populated. And so now you see health threats like sanitation, right? People aren't on the move all the time. If there are issues with cesspools and wastewater, right, like they're living in it, they're right there, there's nowhere else to go. We also see concerns with infectious disease because people are living in closer quarters than they ever have before. We also start to see issues emerge in workers' health and working conditions and how they influence health. So you can see how each era is facing its own health challenges.